A crucial window of time. Doctors monitoring dozens of patients who might have come in contact with that patient in Dallas. And this would be the time when anyone would begin to show symptoms if they caught it. In the meantime, something else we've learned. All eyes on that Dallas hospital, the patient now in critical condition on a ventilator. And now he's receiving an experimental drug. It's not been used for Ebola before to try to save his life. Meantime, from the heartland tonight, these images from Nebraska, where that American journalist, a photographer infected with the virus, arrived in the U.S. today. There he is, suited up in white, wearing a little blue mask, getting onto that stretcher himself. This evening, our Dr. Richard Besser is just back, and we ask, was he stopped at the airport? Plus what the president just said about airports across this country. But first, ABC's Cecilia Vega starts us off in Dallas, this very crucial window of time. Cecilia?
David, good evening to you. Thomas Duncan is on his 8th day in isolation here at this hospital. As you mentioned, he's on that ventilator. He is receiving dialysis after kidney failure, and doctors say his condition is worsening. He's now in critical. As Thomas Eric Duncan fights for his life, doctors are now administering an experimental Ebola-fighting drug. This after officials had said that medicine would make him even sicker.
I can't answer whether if he would have taken that experimental medicine earlier or not would have made a difference. I can't answer that.
Since Duncan became the first Ebola patient ever diagnosed in the U.S., 800 calls a day pouring into the CDC, skyrocketing up from the usual 50. Officials now trying to ease fears.
We don't have an outbreak. We have one event that is being handled properly.
That American video journalist who contracted Ebola while working in Liberia, reaching American soil this morning. That's Ashoka Mukpo in a hazmat suit, walking off the plane in Omaha, Nebraska, before heading to a hospital quarantine unit.
He looked strong. He walked off the plane, gingerly waved to us. You know, he's tentative and frightened.
In Dallas, where Duncan remains the only Ebola patient, the clock is ticking for the 10 people who had close contact with him. Now is the time Ebola symptoms would most likely start to show, 8 to 10 days after their last visit with him. Also today, hazmat teams finished cleaning out that Dallas apartment where Duncan had been staying with his family. That is where they could have been exposed. Those teams destroyed nearly everything inside except for just a couple of personal items, including some photos and a family Bible. David?
Cecilia Vega leading us off. Cecilia, thank you. The president, meanwhile, just before we came on the air tonight, said about Ebola and American airports that the administration is, quote, going to work on protocols, going to do additional passenger screening both at the source and here in the United States. But soon after, White House aides saying additional screening measures remain under discussion. No decisions have been made, so let's get right to our Dr. Besser, who is just back from Liberia. It is great to have you back. And I'm curious, you just talked to your sources at the CDC. Are there any plans in place?
They tell me they would consider any options that would truly make us safer. But for incoming screening to work, you'd have to have symptoms.
You'd have to have symptoms because that's when you're contagious and when people would know. I'm curious, did they ask you when you came back?
They did. My passport was flagged because of the reporting I'd been doing.
They were aware of the reporting, but were they asking other passengers where they had traveled to?
They hadn't.
And you're convinced that might not even help?
It wouldn't, but the outgoing screening is so important. When I left Liberia, they took my temperature 3 times. They asked me detailed questions. They looked to see if I was healthy. Then they gave me this sheet. It's a list of symptoms to watch for 21 days. So important to do.
And you and the team still taking your temperature, what, a couple of times a day now that you're back?
CDC recommends it. I took it this morning. I'll take it tonight.
All right, Rich Besser, great to have you and the entire team back.